So I'm Jamie, I'm one of the Band 5 diagnostic radiographers here in the Addenbrooke's Hospital. My job is to acquire good diagnostic images to allow the doctors to diagnose what's going on with the patient. 90% of patients in the hospital will need imaging at some point, so we are involved in all the patients through routine GP referrals, through to trauma cases, to therapeutic sides. If you decide to become a therapeutic radiographer, you're the person delivering the radiation to treat the cancer. So it's a really wide, varied field. We can be with patients for a very short amount of time. As a result, it's essential to be able to communicate, to establish that rapport, sometimes in only a few minutes, gain their trust, perform the examination, inform them what's happening next, and then send them on their way to the next part of the hospital. You get to combine science and use of technology to acquire good imaging, and it's really satisfying because at least with general imaging, you know if you've done a good job instantly. You don't have to wait for results of a blood test, or it's there on the screen when you see it, so you know automatically it's a good job. So it's very satisfying. There's an instant gratification which I like. I'm not limited in my career choice. I have a lot of branching options that I can take as my interest allows me to do. I could choose to work in CT, I could choose to work in MRI, I could choose to work in nuclear medicine, so I'm very lucky in that sense. When I started training for this career back in 2015, I didn't actually know that radiography was a job. I did medical science at University of Birmingham. Once I did that, I worked as a healthcare assistant, again just to gain experience in the NHS. I was thinking of physiotherapy, but I was also quite interested in becoming a nurse. So being the healthcare assistant was really handy because you get to work with different members of the multidisciplinary team, and it looks very good on your application for other jobs in the NHS, as they've seen that you put in the graft and hard work, so they know that you want to do it. In terms of if you're in GCSEs and A-levels, focus on getting good exam results. Biology or physics would be ideal to have. Make sure that you have the right sort of attitude. You have to want to look after and care for patients, be working well as part of a team, be organised. It'd also be beneficial to try and get some sort of work experience, which can be quite hard in hospital if you're below a certain age. But you can do other things such as volunteer in the care home, volunteer in charity shops. I volunteered in Age Concern UK when I was younger. And things like doing anything with a people-focused job, so in being in customer service, in a supermarket, talking to customers, that all helps us developing your interpersonal skills is really important. I really enjoy working in this career. I would highly recommend it if you're thinking of working in the NHS. It's a very varied career, and no 2 days are the same. It's very exciting, and I would highly recommend you think about giving radiography a try.